Brent Miller is the program director at the Discovery House here in Bangor. Thanks for being here this morning. I appreciate you taking the time.
Don, thank you, and WZON for having me.
Absolutely. First and foremost, can you give people just a brief sort of thumbnail sketch? Who is the Discovery House?
Well, Discovery House Bangor is an outpatient medical clinic that started in Bangor in September 2007. So we've been in business about 6 years. We now serve approximately 600 people receiving treatment for lifelong recovery from addiction. We serve about 600 people in our methadone program and about 120 in Suboxone. Of course, along with that is counseling and a variety of supports as well.
Recovery is certainly a recovery from this type of addiction. One of the strongest addictions that we know of, really, the addiction to opiates.
Yes,
is certainly a multifaceted approach. Really, the only way that you can address this problem. You mentioned the need for counseling as part of this ongoing process. But the medications that you use, methadone and Suboxone, that is a replacement therapy, correct?
Yes. What we have found is that over 93, 94% of the people who come into our program, they're under the auspices of a doctor and a medical team who prescribe, just like you would for any identified disease, and the result is that they stop using illicitly. And so they begin, that's kind of phase one. The medication is part of a really two-step process. The medication eliminates the withdrawal symptoms. It takes away the craving. So physiologically, they are no longer in the throes of the disease, which, as you know, is a neurological one, which rewires the brain and causes a variety of behaviors that are basically destructive of a person. So once the medication is stabilized, and that takes a period of time, then we move into the real recovery, what I like to call the recovery work, which is the counseling and the behavior change, and learning to build their life back up in a positive way. And the data, the evidence, the science is there. It's been studied for 50 years, and I see many people who work the program. In fact, no one who works the program is not successful. And our ultimate goal is to have people transition to a non-medication lifestyle where they are in a community support system, a recovery support system that maintains and stabilizes them for the rest of their life. Because this, as with any disease, is a lifelong illness. This is a chronic relapsing disease proven by medical study. So in order to live a life, they need to stabilize, get a new lifestyle, and take that into the community context where, whether it's 12-step groups, whether it's counseling, whether it's church, whether it's family, whether it's job, they have a stable structure. And we see remarkable changes in people from the day they come in. Within a very short period of 3 or 4 months, they don't look the same. They begin to start taking control of their life. Their relationships with family and friends improve. They often go back to school. They often get jobs. It's a significant and major life change.
Now, you talk about the notion that we're speaking with Brent Miller. He's the program director for Discovery House Bangor. You mentioned in that description of your program that within a period of, say, 3 to 4 months of starting treatment, that you begin to notice substantial changes in a person, everything from their appearance to their behaviors. That's a fair period of time, though, and I think that indicates, even to somebody who's completely unfamiliar with the problem of addiction, the idea that recovery is a time-consuming process, and it is not something that can be accomplished overnight, and it has to be it has to be approached in that fashion. Obviously, there has been work done for a long period of time here to develop effective addiction treatments, and this is what has been arrived at, right?
Right, absolutely. I mean, one of the things that is problematic about the public's understanding of addiction is they look at it as a moral choice. I don't think someone would ask a person or even think of it if I had heart disease, that the medical definition for a problem I had was defined as heart disease or arthritis or seizure disorder. Mm-hmm. You wouldn't be saying to the person, well, that's something that you should be able to get rid of in 6 months and stop your meds. You wouldn't consider that in that context. And this is nothing about a moral choice. It's a disease. It's the evidence, the science, the data is unequivocally clear that the brain is rewired. They have studies. They have actual CAT scans of the effect of the brain and what happens to it. So damage is done that rewires the thinking process in effect. And so you're talking about a lifelong disease. This is a disease that is not going away, that the only way it can be remediated, like anything, is you seek treatment. Like heart disease, you go get heart meds, and it helps you have a quality of life. It sustains you from having a serious incident which may cause death. And so people need to think of this as a disease. It's lifelong. It has a relapsing tendency. And so treatment, and if you don't treat it, like any disease, it will worsen and it will continue. Mm-hmm. So, Don, one of the things that I want people to know is that the largest population that we serve in Discovery House Bangor, for example, is 25 to 29-year-olds and 30 to 34-year-olds.
You're talking about people with a long life ahead of them, or certainly that's the hope, an opportunity to become very positive members of their community.
Exactly. So it's not a moral choice. It's a disease, and that it requires treatment. And the only way, if you don't treat a disease, it gets worse and it continues. So the only way, and we're paying for it now. If you look at the data, and I'm not that much driven by data in one sense because it's more about human beings and compassion for me. But on the other hand, the data's out there, and if you look at the evidence and the science on it, in Maine, it's about $1.4 billion cost, which in 2010. And if you extrapolate that to you and me, what does that mean? That means that $1,000 a year on average is each adult is paying for this issue. I don't think I know of one person who hasn't experienced the effects of alcoholism or substance abuse or prescription drug issues or marijuana issues. It's pervasive. It's, I think, the epidemic of our time, and I'm a big believer in the Bangor citizenry and in the state of Maine. I love both. I feel this is a place that is very progressive and very committed to caring about people.
Now, I must tell you that on a number of occasions, when I've been having conversations with people, and I talk about the fact that there are actual physical changes that occur that are consistent from one addicted individual to another. You mentioned the fact that it is not a moral choice. I guess at some point in that chain, somebody has made a decision to use these drugs. But I think it's also important to note that we all have our weak moments.
Right. Let me break in on that, because I think that's a common misconception that it was a choice. Oftentimes, and you should know, the studies are pretty consistent on this, and at Discovery House Bangor, we've seen the same thing as we've done. We do 5% of our population monthly. We do surveys on 75 to 80% of people who become addicted to opiates got there through legal medical means. In other words, the common story I hear is, okay, I had a bad car accident, my back was traumatized, I had surgery, I was in tremendous pain post-surgery, and I was prescribed, as was necessary, a pain medication to deal with that. And within a very short period of time, I became dependent on that. That's the story we hear over and over. And this can be policemen, this can be lawyers, this can be doctors. This can happen to anyone when they have a medical condition or an accident that causes them to need pain med in a very legitimate and necessary part of their treatment.
I appreciate you pointing out that fact. We've talked on the program before about the problem of the overprescription of pain medications and how that is a major component to the ongoing issue of addiction, especially here in Maine. I think Maine's problems with addiction to prescription narcotics is just way out of whack when you look at Maine as compared to the rest of the country. What I really asked you to come here today to talk about, Brent, is a situation that's rapidly approaching. It's going to happen as of January 1, and that is that people who are benefiting from this addiction treatment with medications like methadone and Suboxone are going to find themselves out in the cold, as it were, when January 1 rolls around, if they are, in fact, within this group of so-called non-categoricals who are benefiting from care by way of the Maine Care program. Brent Miller, he's the program director at Discovery House Bangor. I appreciate you being here this morning.
Don, again, a pleasure. Thank you.